Media Group podcast with our host, Dr. Jim. Dr. Jim, here we go with another topic. It was interesting to talk about those alternatives last week on the podcast.
Mhm. Absolutely. Yeah. I'm always open to different alternative methods to kind of combat a lot of these pain syndromes. That's for sure, Neil.
Understanding nerve pain is our topic today. So, for listeners who might not understand it fully, what exactly is nerve pain and how is it different from muscle or joint pain?
Well, nerve pain is there's a little relationship between muscle pain and nerve pain for sure. We have nerve fibers that are filtered basically through each disc throughout our spinal column within the context of our vertebrae, and these nerve fibers they are very specific in how they branch out, and they continue to kind of subdivide throughout our body into little smaller neuropathic complexes. And these nerves are basically essential for our whole being. So, in essence, just a brief overview. Our brain can't function without this neurology. We can't, obviously, we can't think, we can't process information. We certainly, our heart can't beat at the rhythm that it's supposed to beat at if our nervous system isn't working appropriately. We can't breathe. Our respiration is kind of linked to that also. And so, in essence, these nerves, they control everything. They control our digestive system. They control our endocrine system. They control all these systems of our body. And so, when it comes to pain, inflammation is usually sort of associated with these types of neuropathic pain syndromes. So what happens is you can slip a disc, or you can end up having a migraine type headache or cluster headache, and these nerve fibers they get inflamed, and they start throwing out these awry signals. So these are signals that are not normal. You have these normal signals that are being transmitted, that you feel fine, you feel normal, you can move, you can think, you can breathe. But when this inflammation is accompanied with a neuropathic type pain, uh, you begin to get all kinds of very strange sensitive uh, signals from the nervous system. So basically, you can have burning pain, you can have ice picky type pain, you can have throbbing pain, you can have uh, numbness, you can have tingly sensations. So in essence, there's a signal from your brain to your spine throughout the rest of your body that's being interrupted generally, and your brain's telling your body that this transmission is not fluid. So the only way it can kind of um, uh, basically reflect that to us as people is through some sort of discomfort or pain. So basically, it's um, your body's alarm system to tell us that something's not right. So nerve pain generally, like I said, can be a variety of different sensitivities, but most of the time, a nerve pain is an electrical type pain, and it can be almost like you're being shocked, or you're being stabbed, and you're almost like you're being lit up, for lack of a better term. And it is if nobody's ever experienced it, there's lots of people that have. It is really, it can be really excruciating and rather debilitating. So that's a difference of nerve pain rather than, or neuropathic pain rather than maybe soreness. Soreness, obviously nerves are involved. You work out really hard, you took a long hike, and you're kind of sore feeling. Yeah, that's more muscular. The nerves are more indirectly connected with that sore feeling. Or if you get banged up, let's say you fell and you kind of sprained your knee. That's going to be more of a throbbing kind of a sort of a sensitive sore feeling. But a nerve pain, which is where some sort of nerve is being encroached upon or disrupted, pinched, you're going to have typically a really different type of pain that can be rather excruciating and debilitating. And sometimes people, they really don't, if they've never experienced it before, they really get overwhelmed by it.
Okay. What are the most common types of nerve pain you see?
Okay. Well, I see, um, we'll start kind of with the top of the body and move on down. I see a type of nerve pain pretty routinely called trigeminal nerve pain. So here on your head, there's a three-way branch of nerves that sort of control the functions and the motor movement of your face. And this trigeminal nerve that branches out into these three sections, uh, people typically will have this if they grind their teeth at night or clench their jaw. You have some people that's one way that they deal with stress. Throughout the day, things are hectic. You're having to juggle kids and careers, and you're dealing with finances. You come home at night, you're trying to unwind, you get ready, you go to bed, and at night, this is when this stress response starts to manifest itself, and people start clenching their jaw or grinding their teeth. When they do that, this muscle here is called masseter muscle, and pound for pound, is probably the strongest muscle in the body. So I don't know if you've ever seen those old clips, those old black and white clips of the big strong guy with the big leotard, and he takes the rope in his mouth and he's pulling the train, right?
Yeah.
That happened back in the day. That was a feat of strength back in the early 1900s. And these guys, they had really extra strong jaw muscles, and that masseter muscle is, like I said, when we take a bite of something, that's, like I said, pound for pound, the strongest muscle in the body. So when you're clenching that jaw, which some people do throughout the whole night, or you're grinding your teeth, and it'd be like almost you're flexing your bicep and holding it for 3 or 4 or 5 hours straight. Basically something's got to give. And so within the context of that area, this trigeminal nerve that's featured to operate your facial muscles, and how we squint our eyes or squinch our nose, or smile or eat for that matter. uh, that nerve's being that muscle's being spasmed, and it's squeezing the nerve fibers. Well, that cascades into a really, really excruciating nerve pain through that trigeminal nerve. So I work on that routinely. I try to get into that area of the mandible between your skull and your jawbone, and I try to kind of break up a lot of that congestion in there, try to break that spasm up, so that nerve can fire freely again, and then you get some resolution of that pain. I also get uh, you know, uh, neuropathic pain, which they call like a radicular pain. The the term would be like radiculopathy. So if somebody has a pinched nerve in their neck, or back when I played football many years ago, it took a lick to my neck, and then all of a sudden your arm just gets really almost numb feeling, and a
Yep.
sharp electrical pain runs all the way down to your hand like a stinger. Um, I see people that have pinched nerves in their cervical spine, and they can get a really really nasty type of radiating pain running down either one arm or bilaterally. So that's a bad type of pain. And as you go on down the body and you get down around your waistline and you get around your top part of your hips, between your hip joint and your backbone, near your pelvis, there is an area called the sacral iliac, or the sacrum. And there's a joint in there called the sacral iliac joint. And that joint has a lot to do with how you move your hips forward and backward. And there's several ligaments in there. And you have the biggest nerve in your body that filters right through that area. And there's a muscle there called the piriformis. And that's the sciatic nerve. And that typically can get squeezed or twisted or pinched. And then these people get, I know Neil, probably heard of sciatica, and
Yeah.
you may have experienced it. It's just absolutely horrible. And, and anybody can get it. I mean, I've had, teenage cheerleaders that have gotten it that can't barely walk, and I've had people in their 90s that have it. So it runs the gamut. And so sciatica is probably, or what they call sciatic neuralgia, is probably the number one nerve pain that I work on. And that really, I would have to say that really is my specialty. And because when I first started doing this, I would see that particular problem time and time again. And I tried to apply traditional Chinese acupuncture to that problem. And it was really, it had been kind of rendered ineffective with that approach. And then I had to go back and really look at the anatomy and look at the nervous system, and kind of see what was going on that was creating this congestion or the spasm that was pinching that sciatic nerve. And so I actually came up with my own sort of approach to treating that. But sciatica is very very common. And then you get on down to your feet, and then we deal with what we call peripheral neuropathy. And that's when your feet start hurting, they start feeling heavy, they have you experience a numb, tingly, burning sensation, and the nerves in your feet are very sensitive. And there's several different reasons why peripheral neuropathy can occur. You can be type 2, or certainly a type 1 diabetic. And because of the metabolic problems you're having with sugar, it tends to reflect. One of the side effects is that it can inflame these peripheral nerves, and it typically settles in the feet. People that have had cancer treatments, post chemotherapy. One of the side effects from a lot of these chemo drugs is that they have peripheral neuropathy in their feet. And you can have spinal cord injuries, which can reflect peripheral neuropathy. So I work on that rather routinely also.
Wow. Yeah, it's there's a lot to this, Dr. Jim, and the way you break it down. How do patients usually describe nerve pain?
Yeah, they are very unhappy. They are extremely uncomfortable. Most of the time, they can't move in certain ways. A lot of times, it's so intense that they can't relax. They can't find a comfortable position. They have a hard time sleeping. Um, but back to what we talked about before, there's a lot of different variations of it. There's some burning, there's some tingling, there's some numbness, But the worst part is this shooting electrical, like you're being shocked, like you've been kind of stuck your finger in a light socket type of pain, and it can be intermittent or it can be consistent. And when it gets consistent, people really have a tiger by the tail, and it can be very mentally distressing. I have seen a lot of patients that have had a lot of depression and anxiety, that accompanies this type of that type of nerve pain, and it can be debilitating in nature. So yeah, particularly patients that have never experienced it before and they have it, it can be overwhelming.
It sounds like it's an overwhelming thing, and basically, it's looking at it and saying, "Okay, I'm dealing with this right now. This is what's happening to me." That's the challenge, right? To identify what type of nerve pain it is, and what the patients are saying. What typically causes the nerve pain? I know you've discussed this a little bit, but let's go deeper into this.
Yeah, nerve pain, there's just a lot of different variations. You can have neuropathic pain that presents itself as a headache. A migraine is a migraine headache is a type of a neuropathic pain. But so in essence, these nerves in your head, these cranial nerves, they get inflamed, and there's a variety of different reasons that can occur, and you can get sharp shooting type pains throughout the top of your head or within your temporal region, or the back part of your neck in your occipital area. um, you know Headaches, like I said, there's just a lot of different variations to that. Facial nerve pain can be back to the trigeminal nerve uh, pain that I've worked on. This facial nerve pain, I treat several patients that have dealt with that. Extremely painful, very sensitive. You can't. Some of these people, they go in for a dental procedure, and they come out with this type of neuropathic pain. A lot of times they'll go back to their dentist, and they'll complain about this. Some of these dentists will address it. Some will say, well, I did everything. I pulled your tooth. Everything's fine. Just take this prednisone, take this pain medicine. It's going to resolve itself. Well, it doesn't. They went in there, they yanked a tooth, they inflamed some dental nerves, and before you know it, this patient is they can't open their mouth. They certainly can't bite down on that side of their mouth. They can hardly talk, and man, they are in a world of hurt. So, there's different types of facial nerve pain, but one of them is that. And, some people have nerve pain that's associated with what we call Bell's palsy. And Bell's palsy is, in essence, a facial paralysis. And I see quite a few patients that have this type of disorder, and that's theoretically linked to maybe catching some sort of virus. That seems to be the reasonable explanation for that. But there are other theories why people get this, and some people think they're having a stroke. They wake up one day, they look in the mirror, and half the side of their face can't move,
Oh
and
man.
it's just absolutely overwhelming. And so, with that paralysis, um, you're going to have some of the nerves in their face inflamed. So even though they can't move it, the nerve complex is
Right.
hot and inflamed. So I work with those people. We try to resuscitate the nerves in their face, and by virtue of inducing more blood flow, and maybe sometimes I use electricity or ultrasound with a patient that has that problem. We get the blood moving in there. We break up a lot of that tension, and we'll actually in essence, shock the patient with TENS and electrical stim, and try to resuscitate and revive that. But with Bell's palsy, you can have pain also. So that it's a terrible feeling. Again, you can have tingly numbness, but the one the type of pain that most of these people really have a hard time dealing with is that really sharp electrical type pain.
Okay. I think about it when I had the sciatica problems from pro wrestling, and then I went away because I kind of treated it almost as self-treating. What typically, so we talked about typically what causes nerve pain. And basically, how do you approach treating nerve pain differently from other pain conditions in your practice?
Yeah, nerve pain is the way I look at it is I'm looking at I'm trying to find out what the root cause is. What's causing this? Now, if if somebody has had previous surgery or they've had a fresh, scan, whether it be X-ray, MRI, or CT scan, and I see that I'm reading that particular report, and I see that there is severe stenosis in one level of their lower back vertebral column, in which there's encroachment of this neural foramen down in that region. I can treat that, and I can help patient alleviate temporarily or manage some of that pain with that particular problem. But most of the time, I'll tell the patient, "Look, I think this thing looks uh, pretty severe. The language that I'm reading here is not good. You may need to talk to a surgeon for a different type of an assessment." So I'm quick once they provide me that kind of information. I'm pretty quick to check it out and say, "Hey, look, I don't think I can resolve this, but I can help you with this for the time being, along with the medicine that you're taking. But it looks like you're probably going to have some sort of surgical intervention when that happens." But um, that's pretty rare, actually. I see that, maybe 10, 15% of the time when people come in and complain of nerve pain. But the majority of it, we're typically dealing with encroachment of the nerve, whether it be kind of around your neck or within your shoulder, or potentially around joints in your elbow or possibly in your wrist. And that's another type of nerve pain that I didn't mention before, carpal tunnel. That's very common. Um, you know, you want to find out where it's pretty simple in some ways. You want to find out where the nerve is being squeezed and being pinched and being encroached. And a lot of times with this dry needling, um, acupuncture, physical acupuncture type approach, you, it does a variety of different things. You're inserting a needle, and you're using the needle as a tool to go in there and break up some sort of deep fascial muscular congestion that's squeezing, this nerve at a joint within a junction. And if you can break that up, a lot of times you're gonna promote fresh blood in that area, because when things are spasmed up like that, let's say you got a bad shoulder and you're having some nerve pain associated with that, and everything's frozen, you can't move it the way you should be able to move it. And of course, shoulder is the most complicated joint in the body. There's a lot of different rotation that you can gain from the shoulder that you can't get from any other joint. And so this particular type of nerve pain can be very, very painful. But what I'm trying to do with that is I'm trying to break up that congestion, and it's usually several different muscles around the joint that have seized up and they've stuck together, and they're not, and therefore you're not getting enough blood flow in that area. So those nerves in there are really, really hot. You you know the vascular system and the nervous system, they work synergistically. And if you're not getting enough blood flow, then it's going to make nerve pain way worse. And so what I'm trying to do is get in there and break that congestion up, get some fresh blood flow in the area, try to promote some mobility, and sort of rehab the whole joint in order for the nerve to transmit itself accordingly.
All right. Best place to go?
drjamesacupuncture.com or communitynaturalhealth.net.
All right. That was